Imagine being born without an immune system. A simple cold could become life-threatening. A harmless fungus could spread throughout your body. Even everybody bacteria could be deadly. This is the reality of people born with severe combined immunodeficiency, one of the most serious genetic diseases affecting the immune system. In today's video, we'll explore what severe combined immunodeficiency is, why it happens, how it presents clinically, and how modern medicine can actually cure some patients. Severe combined immunodeficiency is a group of inherited disorders characterized by profound defects in both cellular and humoral immunity. To understand this, let's remember the two major arms of adaptive immunity: T lymphocytes, which provide cellular immunity, and B lymphocytes, which provide antibodies. In severe combined immunodeficiency, T cells are absent or severely dysfunctional. Because B cells depend heavily on T cell help, antibody production is also impaired. As a result, patients become vulnerable to a wide variety of infections, including viral infections, bacterial infections, fungal infections, opportunistic infections. Without treatment, most affected infants die within the first few years of life. Severe combined immunodeficiency is usually caused by mutations affecting lymphocyte development. Several genetic defects can cause the disease. The most common form is X-linked severe combined immunodeficiency. This results from mutations in the gene encoding the common gamma chain, a critical component of several cytokine receptors. Without these receptors, developing lymphocytes cannot receive the signals needed for maturation. As a result, T cells fail to develop, natural killer cells fail to develop, B cells may be present but function poorly. Another important cause is adenosine deaminase deficiency. Adenosine deaminase is an enzyme involved in purine metabolism. When it's absent, toxic metabolites accumulate inside lymphocytes. These toxic compounds destroy developing immune cells, leading to profound immune deficiency. Symptoms usually begin within the first few months of life. Common findings include persistent diarrhea, failure to thrive, chronic cough, recurrent ear infections, pneumonia, skin infections. These infections are often unusually severe, recurrent, or caused by organisms that rarely cause disease in healthy individuals. A major clue is that the infant appears healthy at birth but becomes progressively ill as maternal antibodies disappear during the first few months of life. Diagnosis begins with suspicion. Laboratory findings often reveal severe lymphopenia, markedly decreased T cell counts, reduced antibody responses. Flow cytometry can identify which immune cell populations are missing. Genetic testing can then determine the exact mutation responsible. Today, many countries screen newborns for severe combined immunodeficiency shortly after birth. Early diagnosis dramatically improves this outcome. Historically, patients were kept in highly protected environments to avoid infection. This led to the famous nickname the bubble boy disease. However, modern treatment has transformed the prognosis. The most effective treatment is hematopoietic stem cell transplantation. Healthy donor stem cells can repopulate the patient's immune system and restore immune function. Other therapies include immunoglobulin replacement therapy, aggressive infection prevention, enzyme replacement therapy for adenosine deaminase deficiency, and more recently, gene therapy. Gene therapy aims to correct the underlying genetic defect, allowing the patient's own cell to produce a functional immune system. For some patients, this approach has been remarkably successful.